Now, in the midst of growing concern about the coronavirus, we do have a glimmer of hope. This is not the medical community's first bout with a fast-moving, highly contagious respiratory illness. In early 2003, doctors waged a battle against the severe acute respiratory syndrome, more commonly known as SARS. It was the world's first deadly epidemic caused by a coronavirus. Tonight, only on News 5, our Mike Brookbank introduces us to a local researcher whose work more than 1 decade ago is helping speed up the response to today's potential pandemic. Mike.
Yeah, Rob, the information learned during the SARS outbreak is giving doctors a leg up on how to contain and treat patients with the latest coronavirus, COVID-19. That's because both are within 80% similarity.
Medical researcher Mark Cameron.
There is concern about COVID-19.
Like most of us, keeping a close watch on the latest coronavirus outbreak.
It's spreading quite easily and rapidly.
Back in 2003, Cameron, a professor at Case Western Reserve University, was recruited to be part of the rapid research team when SARS hit Toronto.
The approaches and the research that was done in SARS is directly applicable to COVID-19.
That knowledge, Cameron tells me, is making an impact nearly 2 decades later.
The care required for somebody who has that infection is being done very rapidly.
Also on the fast track, because of what doctors learned about SARS, prevention.
That should help roll out treatments and a vaccine quite rapidly, faster than if we were starting from scratch.
However, Cameron doesn't expect there to be one for at least another 18 months, possibly up to 2 years.
It could find enough foothold in the population in multiple parts of the world to come up as something seasonal. That's a reasonable concern and one that people should be talking about and preparing for.
As quickly as it surfaced,
SARS did go away rather rapidly in 2003.
But Cameron and dozens of other researchers continued their efforts.
In preparation for something like this, another coronavirus, which is more easily spread than SARS.
As COVID-19 continues to spread and concerns grow, Cameron is encouraging people to get information about the illness from the World Health Organization, the Centers for Disease Control, or even their doctor, to not only stay vigilant, but also deal with some of the fear that is currently out there. Live in the studio tonight, Mike Brookbank, News 5.